didactic is Irritability and Challenging Behavior Part 1, which should automatically tell you this is like a limited series on Netflix. You get another chance at this. There's a Part 2 coming next time, and that is going to be more focused on medical correlates of irritable behavior. I will end today's session with a little bit of a conversation about how thinking behaviorally can help support our prescribers who are using medicines to treat irritable behavior. And so the two really do go hand in hand. But let me do a little bit of laying a foundation here for today's talk. And I'm not sure I can switch the slides yet, Aurora. So, oh, I see here. Okay, it looks like I can do it on the screen, so I'll do it there. We're going to talk about behavior, but we're going to talk about irritability, and the two are related. And I really hope that I either can convince you the way I'm thinking about this is the right way for you to be thinking about it, or that maybe you're already there and I'm just slow to the table. But I want to think about behavior and irritability together and separately in this talk. And so that leads me to focus first on irritability. That's why I put it in red. As researchers, as physicians, as psychologists, as other allied health professionals like OTs and SLPs, as teachers, we're all trained to talk about behavior in very concrete ways that you can count, ways that you can time. Can you close your eyes and imagine the behavior? If I told you a kid was good, can you close your eyes and imagine good? It takes you a lot of effort to figure that out. If I told you that a kid was doing what he's supposed to do, listening to his teacher, cooperating as soon as his mother asked him to pick up a toy, if you closed your eyes, you could have visualized exactly what that looks like, right? So we are always pushing ourselves to think in really concrete ways and to describe behavior in very specific ways that can be counted in time. And so one of the ways that we do this is we take words like irritability and then even noncompliance, tantrum, self-interest behavior, aggression, property destruction, all the ways we define irritability, and we further define them in very specific ways. So irritability to many of us in the field, to the providers in the field, is noncompliance, which is we ask a child to do something and they don't do what we ask them to do. To tantrums, which most of us understand what a tantrum is, but if we're going to count and time it, it's got to be defined as stomping or crying or screaming or throwing yourself to the ground. Self-interest behavior, hand-to-head hits, head banging on the floor or backward head banging onto the wall, scratching yourself, biting yourself, some kind of self-inflicted injury that causes tissue damage is usually how we define that. Aggression, we all know what aggression is, but to really close your eyes and be able to count in time what you see, what you have to visualize is someone hitting someone punching, someone kicking, someone biting, someone scratching someone else. Property destruction, we're not talking about graffiti here usually, right? Or breaking windows, or maybe breaking windows, but we're talking about out of frustration and anger, do things get destroyed? And this is the way we usually define irritability, but then why do we bother using the term irritability? And I was thinking about that in terms of preparing this talk. And so I really wanted to think about what does irritability mean and why do we use the term? And so right now I have a blank slate. If I asked you, and I won't ask you to do this because the chat's already busy, maybe with really smart things, but if I asked you right now just to think of a word, a synonym, a word that you could use instead of irritable, what would you come up with? You know, the words that I came up with when I was brainstorming, we could be testy when we're irritable. We could be touchy. We could be cantankerous. We could be miffed. We could be grouchy. We could be short-tempered. We could be quick-tempered. We could be crabby. We could be moody. It goes on, prickly, and on. Ornery. Have you ever been described as ornery by someone? Cross, short-fused, bad-tempered, grumpy. People describe me as grumpy all the time. Cranky and impatient. like I said, people can describe me this way. I bet you can describe yourself this way. We can describe each other and other people we love dearly this way. We all have bad days. We all can have moods. We might even have seasons or periods of our life where we're more irritable than other periods of our life. Irritability is a human condition, not an autistic condition. This is just part of being human. And so I want to reframe this for us. When we think about our kids, when we love our kids, when I wake up every day professionally committed to treating children with autism, I don't think of treating irritability and autism. I think of trying to help making a child's life with autism bigger and fuller and easier. And sometimes irritability gets in the way of that, just like irritability gets in the way of me. If you saw me on the highway and the road rage I can get, I'm a pretty irritable driver, right? So you all probably have your own stories about when you're irritable. So I'm trying to depathologize this. And what I'm really thinking about here is that when we're irritable, we're talking about a pattern of behavior. We're talking about a pattern of those behaviors that I described earlier: tantrums, aggression, a tendency toward having these things co-occur or occur in sequence or occur more frequently than we would like them to occur so frequently that it's a pattern that ends up setting ourselves up for having a smaller life than we otherwise would have, that we don't get to go all the places we want to go. We don't get to have all the friends that we would want to have. We don't get the opportunities that we would otherwise have if we weren't always or often or sometimes cranky or crabby or miffed or ornery. But yet we still use this term and these other synonyms for irritability. Why? Because it's shorthand. It helps us describe a pattern of behavior that we're experiencing. And I would contend that we also use it because we see warning signs. We see warning signs that a more serious or disruptive behavior might be coming. And that's how I want us to think about irritability today during our presentation. So we're thinking about both behaviors and irritability. And one way to think about this is that we're going to be thinking about mild and more severe problem behaviors. And we're going to be thinking about some of those mild behaviors as being warning signs that things could actually worsen or get more challenging over time. If this is a life circumstance, if living with irritability, if living with behavior problems is something we all have to do, whether we're a person with autism, a parent of a child with autism, or just somebody who's living as a human being in life, then what does that really mean to live with behavior? You know, a parent on this, on our hub team told me this, like, I sometimes just live with behavior. I'm not necessarily coping with it. And I actually would contend that no, living with it is coping with it. And when you're coping with it, you probably are sometimes managing it. And I bet you some of the tools that I talk about today that I'm going to recommend that you use, many families are already using them, or you may be using them in a way that you don't even notice until I've given you a name for them. But there's nothing new under the sun. There's no magic wand here. There's no miracle. There's smart and hard work and good parenting. And we have more than 400 great parents on this call. So I bet you all of you could have wrote this book rather than me giving this presentation. But my job is to summarize it for you. So hopefully I'm summarizing wisdom you might already have. But aside from living with the behavior, which I think means coping with it, sometimes managing it, also means sometimes changing it. Sometimes we just have to cope. And some days you're just going to cope. Just like your child might some days be irritable, you may some days not have the ability to manage a behavior. So you might just be coping. There are other days where you might actually try to do more than cope and manage, but actually change the behavior. And so I wanted you to sort of start this conversation out by really thinking about what it means to be facing irritable behavior and trying to live with it. It means coping with it sometimes, it means managing it, and it does sometimes mean changing it. And the tools we talk about today will help us do that. The other thing I want to dispel before we get started with any great depth into this conversation is this idea that some behaviors are good and some behaviors are bad. I don't think that helps us. I don't think it helps us. When I say my child's behavior is good today, I don't think that really communicates to you how my child's doing. If you told me as a psychologist that my child is so bad, I have no idea what you're talking about, because context really matters. And so what I really need is a good behavioral description rather than a good versus bad description. So this is not helpful to us. What might be more helpful is different terminology. When a child's behavior is not getting them what they need in life, when a child's behavior is limiting them in some way, limiting where they can go to school or how often they go to school or how long they stay in school, limiting their friends or the type of friends or the type of things they do with their friends, limiting what the family gets to do in the community. When that's happening, it's not a bad behavior. It's just a maladaptive behavior is how we talk about it, right? It's preventing the child from having as adaptive a life as possible, as full of a life as possible, as independent of a life as possible. And so the opposite of maladaptive behavior isn't good behavior. Again, not a really helpful term. The opposite of a maladaptive behavior is an adaptive behavior, one that is helping a child and the family get to where they want to be, get to the things they want to do, helping their lives be bigger and fuller. And so this conversation really is about how do we manage irritability, and then how do we change irritability into more productive behavior, and particularly emotional regulation, because we're all irritable. We're all irritable sometimes, and some of us are more irritable more often than others, right? It is a human condition. And these are things that we all learned. We started learning it when we were babies. Our parents taught it to us, how to manage our own irritability. Our parents taught us how to regulate our emotions. So here is the rub. In autism, the learning challenge is that autism is preventing kids from learning how to manage their irritability themselves and to regulate their emotions themselves in the way that we would normally do that. They're not learning from regular experiences, from ordinary learning opportunities. We need to teach and be more proactive and more structured in how we achieve these outcomes. These are normal developmental outcomes that should happen for everybody. In autism, we have to be more thoughtful and more proactive in doing it. I want to say a word about the difference between mild and more moderate and severe challenging behaviors. When irritability becomes more severe, it can be dangerous. It can be dangerous for the child. It can be dangerous for other people around the child. So our real goal is to take this human condition, this irritable behavior as we see it, when it's mild, whether it's mild in a young child or maybe it's mild as an early sign of a bigger problem potentially brewing for an older child. We want to intervene as soon as we can. Our goal is to stop a mild adaptive behavior from worsening. We want to prevent any kind of more severe or moderate behavior from occurring. When behaviors are moderate and severe, it's going to be hard for us to use the tools that I'm giving you today to de-escalate a child who is aggressive or severely self-injurious or whose tantrums are very destructive, right? It's going to be hard to use these techniques to do that. So our goal is really to go after the purple, the violet here, not the red. That being said, sometimes all you have is the red. And if the skills today are useful to you in those circumstances and it's all you have, then I do hope that they're useful. But usually when we're talking about more moderate and severe challenging behaviors, you're going to need more than what we can talk about here today. You're going to need someone to really help you problem solve. And then just a few words about the causes of irritability. This first list, again, things that all of us can experience. We all have life stressors every day. We can be depressed, we can be anxious, we can have feelings that feel like depression, feelings of anxiety. We all have fears, we have worries, we have phobias, so do our kids. Sleep, just like little Leo, where I really think sleep is a big deal for him. That's an important routine to get right. That's something to improve. When you have little sleep, I have little sleep from last night because I was preparing this presentation, right? And if you saw me earlier today, I was probably a little irritable. Dysregulated blood sugar when we're hungry, or if we have diabetes. If anyone here has diabetes, you know what it's like when you have low blood sugar. Hormonal imbalances. These are all things that can be the source of irritability. And then also a serious medical concern can be a source of disability, of irritability. We'll talk more about serious medical concerns in our next presentation, but I wanted to make sure I put it here as something to roll out, because all the behavior management strategies that we can teach you are not going to do you any good if a child's irritability is sourced back to a serious medical concern. Someone brought up in the chat about Leo, is there pain involved? Somebody's thinking about this already. But the other thing that can be a cause of irritability are things that are more behavioral. When a child is frustrated, when they can't get what they want, when their goals are obstructed in some way, they can be irritable, just like you and I can't, just like my road rage on the highway. When somebody's in my way, right? I can't get to where I want to go fast enough. And so I get mad. Restriction, when we take something away from a child that they want, or when we're asking them to do something they don't want to do and they'd rather be doing something else. Who wants to do homework, right? Also, loneliness and boredom can be a source of irritability. I know I'm highly irritable when I'm bored. When I'm alone and I want attention, I want someone to be talking to me. I want to be enjoying, when my partner falls asleep on the couch in the middle of watching a TV show, I can still watch the TV show, but I'm irritable that my partner's fallen asleep because I wanted to be doing that with somebody else, right? These are things that happen to all of us, and they're going to make our kids irritable too. The difference is we have a lifetime of learning experiences about how to regulate our emotions, and our kids don't have the opportunity to learn the same way. So you're really getting at, why is this behavior happening? And in order to answer that question, we want to use a functional behavioral approach to understanding behavior. This came up in the chat as people were hearing about Lisa's case. People were asking, has the school done a functional behavior assessment? I'm not going to teach you today about how to do a functional behavior assessment, but I am going to try to encourage you to think behaviorally. I already gave you the green part of this equation. The green box, behavior. You got to define behavior in ways that can be counted in time. It's fine if you want to talk about irritability. In fact, I think it helps you humanize and normalize this if you call it irritability. But in order to change it, in order to manage it, you're going to have to call it a behavior that can be counted and timed. I'm not happy right now. I am happy, but happy does not describe my behavior. I'm smiling because you can count how long I smile. You can count how many smiles I have in an hour. You could even get out a measuring tape and measure how wide my smile is if you want it, right? It can be quantified. And so a behavior, something we can manage, something we can change, heck, even something we can cope with better, is better described in ways that we can count in time. And the funny thing about behaviors is they always have consequences, the purple box. There's always something that happens after a behavior. Here's the rub. If you're seeing too much hitting, kicking, dropping to the ground, then that behavior is getting rewarded somehow. It somehow works for the child. If it's happening, it's because it's learned. And if it's learned, it's been reinforced. And so one strategy that you have in this way of thinking behaviorally is to take that reinforcement away for the maladaptive behavior you're seeing, right? Now, that's challenging to do. And so I like to spend a lot of time thinking about antecedents or triggers, and then interventions that focus on antecedent management. So an antecedent is something that happens right before a behavior. It's a thing that I think really allows us to dig deep into prevention strategies. So let me show you a short video, and my apologies if some of you have seen this before.
Can I have a brownie?
Oh, not right now, honey. All right, it's lunchtime.
But why?
Because it's lunchtime. It's not time for brownies.
Open it.
I said it's not time for brownies.
Open it.
Don't.
Open it.
All right, you can have one brownie. That's it now.
So here, what I'm really hoping that you appreciate is that the child's behavior, stomping, screaming at mom, yelling at her, demanding the brownie, mom, give a consequence, giving him some attention, trying to tell him, no, you're not getting a brownie. And then he reacts, well, how? He escalates. We get more of the behavior. Eventually, what does she do? She gives him the brownie, right? So he's learning that having this tantrum is getting him the brownie that he wants. We could tell mom to stop doing that. Don't give in the brownie, but let's face it. Once a behavior is happening, sometimes you just need to get rid of it. You just need to cope. And sometimes you might give in and give the brownie. So a better way to think about this, I think, is to prevent this from happening as best you can. What's the immediate antecedent? She says no. Maybe there's another way she could say no. No, not now. Maybe after lunch. Maybe, well, you can have a brownie, but first I'd like you to eat an apple. And if you're still hungry, then you can have your brownie. Give them a choice. Do you want the brownie, or would you like cream cheese or peanut butter on celery? And see what he likes, right? The point is you can say something other than no if no was the trigger. The other thing to appreciate is where to get the brownie. Was it on the counter? It was accessible in some way. Could she change where the brownies are located so that he doesn't have access to them? Does it have anything to do with the brownie? Maybe he's hungry and he saw the brownie, and therefore what he really wants, he's set up to want something like we all do when we're hungry, that's sugary and fast energy. So maybe breakfast needs to be bigger, maybe lunch needs to be moved up. Maybe it has nothing to do with food or hunger at all. What was she doing? She was reading a book. She wasn't giving him attention. As soon as he asked for the brownie, what was she doing? She stopped reading the book and she was giving him attention. So maybe the real function of his behavior here, the real reason he's behaving, is to get mom's attention. So we know all that just because we can think about antecedents, behaviors, and consequences. And you have to think like that if you're going to manage or change a behavior. So this brings me to thinking more deeply about prevention, and that's going to be the bulk of this presentation. I will move on and talk a little bit more about some consequence-oriented and teaching strategies and some crisis intervention strategies before we end. But let me get deep into some prevention strategies. What prevention strategies do is they try to identify and then eliminate or minimize the trigger or antecedent to a maladaptive behavior. The best intervention is prevention. The best kind of problem behavior is one that we stop happening before it ever happens, right? And so think of it like this way. When we were little, what did our parents do to keep us from falling downstairs? What did you do when your child was younger to keep them from drinking poisonous cleaners? You know, we put up baby gates to keep kids from falling downstairs. We put locks on cabinets to keep them from accessing poisonous cleaners. We don't wait until they have it in their hand and then yell at them for having it in their hand, right? We work to prevent these outcomes. And so we have a list of a range of prevention strategies that we encourage people to use very flexibly. And if you use these, you might be able to really turn irritable behavior into something different than a behavior problem. And so let me take you through each of these just briefly. The first is we might just avoid certain situations of people altogether. Sometimes kids are irritable when they wait in line, and that can escalate to a behavior problem. So we don't go to places where you have to wait in line. We just avoid them. Now, that's not always 100% possible, but it may be possible. It may be possible to change the time you go someplace so that you're not waiting in line. There might be a kid who your child has trouble playing with, and so you work hard not to put your child in that place. Dad or mom might be better at getting a child dressed in the morning, whereas the other co-parent might have trouble getting a child dressed in the morning. So instead of having the parent who has difficulty with the child do it, let's have the parent who is more successful do it. Now, none of these are supposed to be strategies we use forever, but they might be strategies that you use to get by to prevent a more severe behavior problem from occurring. Just like putting up a baby gate or locking cabinets, we might control the environment to prevent a behavior problem from happening. Imagine I was often sat in school in the front row, so I was closer to the teacher. Why? Because when I was in the back of the classroom, I was talking to other kids and I was distracted. Teachers learned pretty quickly that I had to be moved to the front of the class. They had to control my environment to keep me engaged when I was an elementary school student. We can do a lot to control our environments, to change our environments. Putting the brownie in an upper cabinet rather than on the countertop is a way of controlling the environment in the scenario I just showed you. This is an intervention strategy, a prevention strategy that is really useful and very helpful. Doing things in small doses or small steps. Maybe you go to a family gathering, to a party, maybe a cousin's birthday party, and you only stay 15 minutes. And that might be really disruptive, but it's better than not going at all. And if your child was successful for 15 minutes at cousin Joey's birthday party in May, maybe you can go to cousin Sally's birthday party in August and achieve 5 minutes more and stay a total of 20 minutes. My point is, you can do things in small doses incrementally and start seeing success. If your child can't handle a 40-minute shopping trip, maybe they can handle a 4-minute shopping trip where you run in and you get some bread and milk and you get back to the car. Maybe your child can't pick up all the toys that are on the floor in the living room at the end of the evening when they're done playing, but they could pick up one. So you clean up all the toys and then you say, time to pick up toys, and there's only one toy left to pick up. You might have more success in getting the child to pick up that one toy. Doing things in small doses can help you. Doing things in small steps can help you get success. Sometimes just changing the order of events can be helpful. If a child becomes aggressive when they have to turn off their iPad to get ready for school, then what you might do is have the iPad only available to them once they're already dressed and ready for school, right? So we just changed the order and the sequence of events. More on this in a second. I mentioned this earlier, but responding to early signs of irritable behavior is going to be really important. You're the expert on your child. When a child needs extra assistance, when they're struggling, you're going to know it. A glint in their eye, the change in their body posture, sounds they make. Maybe your child doesn't have the words to describe how they're feeling, but you notice their facial expression. You know irritability is coming on. Now you can choose to respond differently. You can try to get their mind onto something else. You can try to redirect them. You can try to bring them to a happier place when you're paying attention to early signs. Like I said in the video response, sometimes the word no itself is a trigger. Instead, you can say something different. You can provide choices. This is a strategy we call changing how you ask or respond. If the way you are setting up a reaction to a child is to respond in a certain way that triggers them, then try to find a different way to respond. We can get a lot of mileage out of that. Another strategy I'd like to really put in your toolbox is this idea of setting events. Children are sometimes set up to have difficult days, just like you and I. When we're hungry, we can be irritable. When we're sick, we can be irritable. When we miss our medications, we can be irritable. When we have a bad night of sleep, we can be irritable. If we just had a seizure, we can be extra irritable. When our parents are fighting and there's disruption in the household, we can be irritable, right? Things happen around us that help to set us up to have behavior problems. And when that happens, it's good to keep in mind that you might change the demands that you're placing on a child. You might expect less of them. You might use other prevention strategies. It might be an awareness or a warning sign for you that you can use something else. And the final prevention strategy that will lead us into a whole other category of intervention is the use of visual auditory cues. Getting a child to stop doing something without warning, just pushing them through to the next task, is often very challenging. So using a timer to indicate that it's time to move on to something else, using pictures to indicate if we do this, then we get to do that, like an if-then board, if you will. When X happens, then this occurs, a when-then kind of construction. Just even putting lists together can help us. I have a list, my little sticky note, telling me what I'm supposed to be talking about right now. We all benefit from auditory or visual cues in some way, which then leads me to this conversation about structured routines. When children are engaged in positive structured routines, we'll see far less challenging behaviors. They'll be less irritable, or if they are irritable, they'll have other things that distract them pretty quickly if you're engaged in structured routines. We want predictable and structured schedules that offer an opportunity to use other prevention strategies. And I remember seeing in the chat about Leo's case, people talking about structured routines. So how do we begin this? The first thing I always ask us parents to do is to lay out a typical day. From waking to falling asleep, what does the typical daily schedule look like? Actually write it out. Identify times and activities that could be challenging. Note and describe any problems that might occur during each activity. Now, this is just the first step. Once you have your typical day written out, the next step is to do some dreaming, to think aspirationally, to step back from the schedule a little bit and say, what would a perfect day, or at least a more perfect day, look like for my child? If everything goes right, what does the day look like? And try to take your child's perspective. What would a perfect day look like? And then begin to think about how you can get something closer to that. Perfect is an aspiration. You're never going to have a perfect day. None of us have perfect days. Some of us can have amazing days and some of us can have really crappy days, but that's life, right? How do we get more amazing days? And this will give you some ideas for how you can start to build more positive and structured routines. Oh, sorry, let me go back one. One way to do this is to be looking at your daily schedule with a rearrangement mindset. See where there are trouble spots. Consider rearranging those trouble spots. Is there anything you can add into the schedule that might make those trouble spots go a little more smoothly? Are there other prevention strategies like small doses that might help things go more smoothly? Changing order of events could help things go more smoothly, right? Combining these two techniques, rearranging a schedule and using some of those prevention strategies, can maybe get you to a potential structured routine that is more beneficial. Changing the time of a demand, like bathing, for instance. When you have more time in your schedule to do it, to allow the child more time to play, might be an easy fix, right? Instead of getting bathed in the morning, let's get bathed at night. Using fun activities to reward the completion of less desired activities. Look, none of us like to stop doing something we really enjoy to go do something we don't want to enjoy, or we know we're not going to enjoy. I love watching television, but if I'm told, get up and take out the garbage right in the middle of a TV show I'm enjoying watching, I don't want to do it, right? But if someone says, you know, before you turn on that TV show, why don't you take out the garbage? I'm probably more apt to do it. And then establishing a routine. I think little Leo would benefit from a bedtime routine, a different bedtime routine than what he has. And I think if he got more sleep, we'd be less likely to be prone to setting events the next day where irritable behavior occurs. My guess is that if we fixed his sleep problems, that kid might have still been an ABA, right? That's how my mom was working as Lisa was telling her case story. So establishing a routine is really important. And when you see parts of the day where there is trouble consistently every day, probably tells us that we need a different routine in that part of the day. So visual schedules can help us do this. We can manage a schedule if we actually have it written out. We can change the schedule so that it's more easily worked every day without behavior problems occurring. It can help us manage unexpected changes. A lot of our kids don't like unpredictable changes, right? But if they're used to using a schedule, then whenever things change, we can embed those changes into the schedule. It promotes stability and predictability, which can increase comfort, flexibility, and independence. Comfort, flexibility, and independence are counter to irritability, right? So if we give a tool where we could teach children to be flexible, we're likely to see a reduction in irritability, or at least a reduction in how long kids are irritable or how often irritability evolves into more severe and challenging behaviors. So visual schedules, like many of you probably have experienced before, are really useful. If you use them successfully earlier in a child's development, it could be possible to bring these visual schedules back. You see two examples of this, but I'm giving you a to-do list. A visual schedule is something we all use. We all use a calendar, right? Any kind of visual schedule. If you can read, you probably have a visual schedule, right? So kids who maybe aren't reading yet or won't be able to read might use a picture schedule. That's all this is. I'm going to show you just a brief outline. These slides will be available. I'm not going to walk you through these steps, but if you wanted to think about, if you've never really been exposed to how to use a visual schedule, these are the steps that would take you to do that. A video is worth 1,000 words. Let me show you a brief video. And this is really for folks who maybe have never used or seen how a visual schedule
All done brushing your
can be
teeth.
used.
Put it in the bag. Very good. Now what do we have to do? Put on coat. Okay? So let's go. Take it. All right, let's go put on your coat. Come on, let's
Now,
go.
this is a child just being introduced to a visual schedule, so there's a lot of help. But eventually he'll
Put on
get
your
more
coat. Let's
independent.
put that in the bag. All right, what's next? Put on backpack. Okay, let's go.
So she's walking him through a micro routine,
Come on.
part of the day that was
Yeah.
problematic for them in the past, but one that's improving now that there's a visual schedule embedded. Let me jump out of schedules and prevention strategies and talk about how we respond to maladaptive behavior. How do you manage consequences? And I'm going to talk about ignoring. I'm going to talk about compliance, how we build a pattern of compliance, how we teach and regulate emotions, and how we manage crisis intervention. And this will be quick because I really do think the best bang for your buck is in prevention. But I'd be remiss if I didn't highlight some of these things. And the first here is for us to think a little bit about planned ignoring. Let me show you this video as a way to introduce this topic.
Here you go, bud. Here. Peanut butter and jelly. Come on. Sit up.
Chicken nuggets.
No, I'm not having chicken nuggets.
Chicken
again
nuggets.
today.
Chicken nuggets.
Sweetie,
Chicken nuggets.
We are not
Chicken
having.
nuggets.
You had chicken
Chicken
nuggets
nuggets.
yesterday.
Chicken nuggets. Chicken nuggets. Chicken
Peanut butter-
nuggets.
Look at this.
Chicken nuggets.
This is your favorite kind. Mommy made it for
Chicken
you.
nuggets. Chicken nuggets.
Look at me. Look
Chicken
at me.
nuggets.
We're not having chicken
Chicken
nuggets.
Persist.
Chicken nuggets.
Mom continues to
Chicken
engage.
Can't have
them.
it every
Chicken
day.
nuggets. Chicken nuggets. Chicken
Watch
nuggets.
what happens.
All right, fine. All right.
She gives up.
Go get you some chicken nuggets.
Right? What have we done here? We have just taught this child to be persistent, and we have really taught strong resistance, right? His irritable behavior, trying to get what he wants, has resulted in him actually getting a response from mom that reinforces it. So instead, what I would teach a mom in this scenario to do is to really ignore his persistence. Avoid eye contact, don't touch him, keep a neutral facial expression, don't talk to him, don't respond to him when he's bugging her. Ignoring should be obvious, abrupt, and exaggerated. But this is hard to do. And it's hard to do in part because we know behaviors will get worse before they get better. Some behaviors can't be ignored, but look at the orange box. I'm going to give you some strategies for what to do in that scenario. Children can learn to be persistent. If you ignore, then you give in, all you've taught them to do is to get longer and louder and harder in their persistent negative behavior. So you can't give in. Once you start this, you got to follow it through. It can take a while to work when you're using this. And then I return to this idea that some behaviors can't be ignored, but another way to say that, not all behaviors can be completely ignored. And what I mean by this is that if a child has an annoying behavior, let's say that mom is like, I cannot not respond to him when he's saying chicken nugget, chicken nugget, chicken nugget. What I would say to her instead is, okay, if you have to respond, then respond to him about something else. Talk about the playground that you were at that day. Talk about how school was today. Talk about something other than chicken nugget. And if he starts talking about chicken nugget, turn away. And the second he takes a breath, turn back to him and start talking about other things. Eventually, this child will get off the chicken nugget and probably eat a sandwich because he wants the social attention from mom. The green, ignore the child, not the behavior, is what we do when a child is engaged in something that's harmful, severe behavior, a maladaptive, irritable behavior, right? In this scenario, if a child is banging his head against the wall, I will ignore the child. I won't talk to them. I won't say anything to them. I won't even really look at them. But what I might do is put a pillow behind their head and try to prevent the behavior. So I'm paying attention to the behavior, but I'm ignoring the child. This is a way that we can intervene in many irritable behaviors. And the sort of last irritable behavior intervention strategy, and then I'll say a word or two about emotional regulation, is building habits of compliance. We know that non-compliance is a habit. Just like any other bad habit we have, we're going to need a lot of practice to undo it. I love to eat junk food. I love ice cream. I love cheese curls. I love chocolate bars. It really is hard for me to stop eating junk food. I need a lot of practice. And the good news is every day I wake up, I have another opportunity to practice not eating junk food, right? The same thing with our kids. They need a new habit of compliance and they need a lot of opportunity to practice it. So how do we do that? What we usually do is we have this compliance practice model where we say make 2 lists. The first list is a whole bunch of things the child will definitely do. I call that list A. And then list B, you come up with a list of things the child can do, but they usually won't do. Take your dish back into the kitchen, right? And then what I say is practice every day, but practice list A, the things the child does do, and hears you say, good job after every time you do it. Practice list A 3 times a day. Practice list B one time a day. So you get this 3-to-1 ratio. And what's happening is the child is learning that with list B, you have to help them do it, but they get praise because you're going to provide help and actually help them follow through with it. And in list A, they just do it because they want to do it. Eat this M&M, right? Pick up the blue crayon, it's your favorite. Good job, you did that, right? They hear you praise them for compliance. This builds a pattern of compliance. And when you do it at this ratio, you'll see your child turn around. So these are the steps. When you're trying to build a pattern of compliance, you want to be close to the child and give them the attention that they need to hear your command, to hear your instruction. And you give them the instruction. You tell them what to do. At the same time the child is completing the command, you give them all the help they need to do it. If they don't need any help, great. If they need a little help, fantastic. If they need a lot of help, great. The next time you give that command, provide them less help. Just keep trying to move through the compliance training paradigm like this. And as soon as the child complies, even if you help them, praise them. If you do this, you'll start to build a pattern of compliance. I'm going to skip this video here just because I want to save some time for questions. The last 2 things I'm going to mention are regulating emotions and then how you put this all together in a crisis plan. The first thing about regulating emotions is that prevention is our first step, right? Prevention is the beginning of teaching emotional regulation. Emotion regulation is a life skill. We all have to learn how to regulate our emotion. We learn from our parents and from other adults in our lives when we were younger. Again, I think for children with autism, emotional regulation being a life skill is harder for them to learn because autism gets in the way of that learning. And so co-regulation is important. They need us as coaches all the time. And what are those skills? We need to teach relaxation. Now, relaxation to this guy, who I know pretty well, is going to look really different than relaxation does for me or relaxation does for you. So you have to learn what floats his boat and what relaxation is going to be for him. But we need to teach relaxation. We need to teach kids how to get there. We need to teach how they should respond when they are angry. We need to teach how they should engage in emotional identification, labeling emotions, and then connecting those emotions to these strategies of relaxation and anger management. Kids need to have strategies to solve problems. If you have one solution to a problem, you don't have any solution. You need multiple solutions to a problem, and you need to be able to pick one and decide if it really does solve the problem or not for you. Kids do better with emotional regulation if they know how to ask for help, if they know how to engage in social interaction. Even when a child has limited verbal skills, they still can learn to engage in reciprocal social engagement. And for kids who have a lot of language, beginning to teach them how to restructure the way they think about the world around them. That when somebody tells them no does not mean no forever, for instance, right? It just might mean no for now, or it might mean no until I can negotiate a yes. That's a different way of thinking about that. And that's called cognitive restructuring. And for a lot of this, you're going to need help. You're going to need therapists who can help you develop this. The final component of this talk today is really thinking about how do you build an intervention plan for crisis. Irritable behaviors can and usually will escalate, so you have to have a plan. I think part of that plan is knowing what are the early signs of an irritable behavior getting worse, what are the setting events where a child is more likely to be irritable, really thinking about that, making sure all adults in a child's life knows that those strategies are going to be necessary. You're going to use the strategies we talked about here today. Parents are going to be coaches in a crisis. We all benefit from someone helping us remember what we know how to do when we're upset, right? So having a coach in a crisis is really important. Someone who is supporting us and helping us go. And we have to make sure that we have a safety plan, that we have an exit strategy, that we have a strategy for de-escalating the demands on a child when they're getting really upset. And some of that will also involve making sure we have helpers around when a crisis gets really bad and we know next steps. So how do you get support? One is to make sure that local resources are varied and that what is available in my community may not be available in your community. This is where our autism response team might be helpful to you. Parent training is a relatively accessible intervention strategy that everybody can use with any counselor in your community. We have an evidence-based parent training program called Ruby Parent Training. You can learn more about it at rubynetwork.org. This approach can really be implemented by any counselor anywhere if they get the manual. The manual is relatively inexpensive to purchase. And if you didn't want to do that, you didn't want to work directly with the therapist, but you have a phone, you might be able to use a digital therapy that we call Attend Behavior. It actually uses that same curriculum and helps parents implement parent training on their own without the help of a therapist. I'm going to stop there and save any comments that I might have made about engaging with medication treatment. I'll pass that material on to our next presenter for the next session because we're pretty much at time and I want to give a little bit of room here for some questions.